Diagardes.
Doctor, doctor, I'm screaming, doctor, doctor.
Oh, my aching back. Oh. Yes, that's our topic of discussion today with our favorite family physician, Dr. Stan Anderson. He's on our WHBC Newsline this morning. Good morning, Dr. Stan.
Hey, Pam, great to talk to you.
How many times have you heard that? Oh, my aching back, right?
Well, daily.
Yes, exactly.
So I thought we would talk about, we've been talking about disease states and different problems that people deal with. And I thought, okay, what is one of the most common things that I actually see in the office? And it's back pain. Yeah. More people show up with back pain than just about any other joint or body part that hurts. And in the research, when you start looking it up, what you'll see is that somewhere around, at any given point, somewhere between 9 and 12% of people are struggling with low back pain. So it's something that is incredibly common. Somewhere around 90% of us throughout our lifespan are going to end up having back discomfort. So back pain is something that is ubiquitous. It's so common. And there's a lot of things that we do sometimes that work, and sometimes we do them and they don't work. So I just thought it would be a good idea for us to kind of talk a little bit more about what to do and how to prevent it and things we can do about it.
Yeah, that's a great idea because it happens for a lot of different reasons, right?
Yeah, and so you really want to be worried if you have atypical symptoms. So if you have something called a radiculopathy, so the pain starts in the back and then radiates down the leg, or if you've had this back pain and then you start losing weight. So we're always worried about either cancer or if there's a nerve involved, or we're worried about infection. So if you have back pain and then you start developing fevers, those are warning signs. Those should be big signers that say, ooh, I need to get in to see my healthcare provider, because one of the things is if you don't treat cancer or you just treat an infection with just the same thing that you've been doing, it's not going to be a good outcome. It will always progress. And the longer that you end up having cancer that isn't diagnosed or an infection that isn't diagnosed, the harder it is that it's going to be to get rid of it. So those are warning signs. If you have those things, so unexplained nausea, fevers, if you have radiculopathy, if you have unexplained weight loss, those are things that, yeah, we're really worried about that, and we're going to be a lot more aggressive with getting an MRI or a CT scan in order to try to answer the question, what's going on in the back. But for the most common back problems, that's not what most people deal with. The most common issue is that we're doing something, we lean over, we bend to pick something up, boom, and we tweak it. And so it's more likely to be one of the day-to-day types of things. Now, some of us have more arthritis than others. So that means that we're more likely to end up having the tweak or the irritation be a lot more of a problem for us. So if you're not having very much muscle, or if you really have a lot of arthritis or you're really stiff, you're more likely to end up hurting yourself when you do end up going trampolining, or you decide to go jumping, or you decide to start in a new program. That's when you're going to end up having worse outcomes. So, yeah, you're going to try whatever you can. Usually the moment any time starts to bother you, mostly what we recommend is start with rest, ice, compression, and elevation, if you will. So we talk about taking it easy. We talk about putting some ice onto it. But then within a day or two, what you really want to do is you really want to start flexing. So you want to work on your flexibility. You want to work on some leg strengthening exercises. All of those things are going to be beneficial because your back is just the core part of you that ends up bothering you, everything that goes from it. So, yeah, if it's more the upper low back, it's going to bother you when you twist, when you move your arms. If it's your lower low back, then you're going to end up having more of a problem going down your legs or to the buttocks or to the all the way down the leg. The nerve can be involved. The critical thing to do is normally what we do is we talk about really working on trying to get rid of anything that is specifically an issue. Chiropractors are wonderful with helping people when they have a back tweak, when they have a back strain. They're really good about helping people to really work on the alignment, working on the discomfort. In studies that are done where people have a choice between seeing a chiropractor or going to a medical doctor, outcomes are almost the same for the initial part. So from a pragmatic point of view, if you have a tweak, go see your provider, go see your practitioner, and get it fixed. We talk about the duration. So most back pains usually last somewhere between a month to a month and a half. That's the usual expectation. The worst is going to be in the first few days to the week. If it's more than a week, you probably should see someone to try to get on medicine or to try to get it started. Physical therapy is what we oftentimes will start with because they'll use some ultrasound, some electrical stimulation. They'll talk about stretching, and they'll talk about the specific strengthening exercises to help you to improve. If it's more than 6 weeks, then you're in that subacute phase. So if it's more than a month and a half, then it's persistent. This is not going to go away quickly. Chronic low back pain is if it's been there for more than 3 months. And there's quite a few people that have chronic back pain. It's related usually to some type of a connection, whether it's arthritis, whether it's a spur, whether it's a herniated disc, whether it's an alignment issue. All of those things can end up being a thorn, if you will, that ends up really being an irritation. So we talk about medications that we can use. In studies that were done where they compared Tylenol to Advil, Tylenol had no improvement. So just kind of an interesting thing. We love Tylenol. We use it all the time. But when it comes to back pain, Tylenol is probably the least effective of almost all of the treatments. Now, if you're taking a blood thinner, it's about all we have. So if you're on Coumadin or if you're on Eliquis, then yeah, we're going to end up saying take Tylenol for your back discomfort because we can't use the ibuprofen medicines. There's several prescription medicines we use. We talk about muscle relaxants. We talk about anti-inflammatories. Long term, we talk about corticosteroids. Interesting, in acute back pain, prednisone or a steroid burst helps some people, but not that many. So generally, most of the back pain specialists end up frowning on starting on steroids at the get-go, unless that has been something that has helped you a lot in the past. So the reason I say that is because once you injure your back, so that is the most common reason for people between 20 and 40. So once we become an adult, it's one of the most common reasons why we go see a doctor or a healthcare provider. And what happens is you get over it, but having back discomfort dramatically increases your risk for another back problem just down the road. So the critical thing is you really want to work on your weight, your flexibility, and strengthening your core. That is fundamental, and that's one of the biggest things that I see. A lot of people start well, but they don't finish well. They do just enough so that the pain is gone or controlled, and then they end up stopping with the aggressiveness. Yeah, this is more a lifetime problem they really need to focus on. And the good news is for the vast majority of people, we can get people dramatically better.
Yeah, when I went to physical therapy and learned what the exercises were, if you keep them up at home after the fact, it does really help. It does really help because it continues to strengthen you, you know?
Absolutely. Yeah, the same thing that triggered it in the first place, unless you make that go away, you're likely to have it triggered a second and third and fourth time. So, yeah, you gotta stay with it. You can't just, it's not a one-off.
Well, I wasn't trampolining, I was tying my shoe.
Yeah, be careful about pogo sticking.
That's the other one. Yeah. Oh my gosh. Oh, that's a lot of good stuff, Dr. Stan, because there's not a person in my life who hasn't been affected by low back pain. I'll tell you that right now for sure.
It's so common.
It is. It is. Well, we will chat again next Wednesday, sir. Thank you so much.
Hey, I look forward to it.
Canton's Morning News with Pam Cook.